So here's what we're going to cover today. We're going to talk very briefly about the stages of traumatic brain injury, the impact that TBI has on cognitive skills. We're going to talk about the concept of cognitive modifiability, this idea that we actually can change brain function with the right application of stimuli. We're going to talk a little bit about our cognitive skills program, but more importantly, just what are the foundational components of any cognitive skills program that can help patients recovering from traumatic brain injury. And then we'll open it up at the end for question and answer. So have your questions. You can be writing them down. If you prefer, you could put questions in the chat as well. We'll probably save them till the end. But either way is fine if you want to put them in the chat, or we'll open up the mics at the end of the session as well. So without further ado, we're going to dive right in. And I want to start with a little bit of a case study today. This is a client we worked with a few years ago. We're going to call him Benji. That's not his real name. But when he came to us, he was 20 years old. He had been in a very, very severe car accident at the age of 18. He had a lot of trauma, broken bones, and other things. And he had a severe head injury. He was actually in a coma for about 3 months. He was not expected to survive, but he was young and very fit, and ultimately did survive that trauma, which was quite amazing. He lost vision in his right eye. And when we started working with him, he was about 1 year post-trauma and had really made remarkable recoveries physically. But he still struggled a lot with cognitive skills. And so we're going to talk a little bit about some of those hidden impacts of TBI. And so after, especially if your concussion is brought on by some kind of trauma that's extensive, oftentimes we spend a lot of time working on the physical pieces of that, but we don't always move on to work on the cognitive skills. So that's what we're going to talk about today. So what is traumatic brain injury? It's a disruption in normal brain function caused by an external force to the head or body. It impacts a lot of different things, how a person thinks, feels, and functions. So it impacts thinking or cognition. It can also impact emotions and behavior along with general physical functioning. We know that every TBI is different, that the changes related to any kind of brain injury can be temporary or they can be permanent. And we don't always know what that trajectory is at the beginning of the diagnosis. They can be mild to severe. They can be immediately visible, or sometimes a delayed onset of symptoms, things that come up later on that maybe are not expected, but don't have any other cause and can be sometimes attributed to that injury. A couple things to know about TBIs. TBI is often called an invisible injury because because many of its effects are not outwardly obvious. Even mild TBIs can significantly impact daily functioning, and we're seeing this more and more. That it doesn't have to be a catastrophic brain injury in order to have impact on daily functioning. Effects can evolve over time, especially as demands increase. So thinking about returning to school, returning to work. Sometimes patients feel like they have a good recovery, but when they start to go back to the full scope of their daily responsibilities, they start to have challenges at that point. And we know that no two TBIs look the same. And so anytime we're dealing with a patient who's struggling to recover from a TBI, we're not always sure what that trajectory looks like. And that can be really frustrating sometimes. But we do know what kinds of methods and therapies have an impact on brain function. And that's what we want to talk about today. So there are two main stages of traumatic brain injury. There's the acute stage and there's the chronic stage. When we're talking about doing therapy to work on cognitive skills, we're going to be working in the chronic stage, not in the acute stage. So we're not going to spend a lot of time here, but it's important to understand the difference between these two stages, because if you're still in the acute stage of TBI, you're not ready quite for working on cognition. So in the acute stage, in this phase, we have deficits that are often global. Patients tend to still be unstable and influenced by medical factors, so swelling, medications, fatigue, and pain. This is the first 3 months post-injury. So that's considered the acute stage, at least 3 months. So we don't work with any clients who are less than 3 months out from their injury. Once we're beyond 3 months and can be for the rest of the lifespan, we're considered in the chronic stage of TBI. In this stage, deficits become more specific and consistent, more functionally evident, especially in higher level tasks. So when we're thinking about more complicated tasks is where we're going to see the impact of those effects. And this table just gives us a little bit of a contrast between what's happening in the acute versus the chronic stage. And what you'll notice if you look at these descriptions is that once we move into the chronic stage, we're looking at some more of those hidden symptoms. So they're a little bit harder to identify and maybe associate with that TBI. You might be a year out from your TBI and experiencing some of these chronic symptoms and not understand why. But oftentimes it goes back to that injury. So looking at the different areas that are impacted, we really are going to talk about 5 different areas that are impacted by TBI. So the first area is attention and concentration. These are some of the symptoms you may experience if you're in the chronic phase of TBI. Difficulty sustaining attention, especially lectures, meetings, long tasks, anything that has a lot of verbal information coming in, like me going through this lecture about TBI, is in that category of impact. Difficulty sustaining attention, especially for auditory input. Reduced divided attention. So difficulty not only sustaining attention on one task that's specific, but also considering multiple sources of information or divided attention. Slower processing speed overall, and mental fatigue. So the ability to be able to sustain high-level mental work is often a big factor that we see in patients recovering from TBI. We also see impacts in the areas of language and communication. So word finding difficulties, what we call word retrieval, the ability to be able to pull that specific vocabulary for the thing that you're thinking of. Trouble organizing thoughts verbally, reduced social pragmatics. So difficulty with social communication is also something that that happens post TBI, and a lot of times this will be something that people feel like this person's personality has changed, but it may be partly their personality, but also just their ability to be able to interact socially in the same way can become impaired. Difficulty understanding sarcasm or abstract language, abstraction in general, for some patients becomes more difficult. So these are some things you might see in the areas of language and communication. Executive function is another area where we see a lot of impacts post-TBI, and there are actually a lot of different cognitive profiles that impact executive functioning. But especially if your injury was in the frontal lobes, it's those frontal lobes where the executive functioning takes place. And the executive functioning is sort of the ability of the brain to manage complex tasks. So our executive functioning is where we pull together all of the information and skills we have to complete a complex multi-step task. So some of the things that are required for executive functioning are planning and organization, time management, initiating tasks, problem solving, flexible thinking, self-monitoring and error awareness, and impulse control. So these are all areas that can be impacted. The next area we see impact frequently is processing speed. So slower thinking and slower response time. And this can be really frustrating. I think the patients that I work with, this is one of the most frustrating things for them because they know they need more what we call think time. So more time to process information. If you're a caregiver for a patient recovering from TBI, this is really important to know because you might be talking to your loved one, and they just need some time to think through what you've said before they respond. So it just requires a lot of patience on the part of the caregiver. But oftentimes when we sort of give that extra think time, we allow the silence to sort of sit there for them to process what they've heard or had input read in some way. Then they can pull that information and organize it more effectively. Because processing speed is slower, it takes longer to complete schoolwork or tasks. If you go back to that first slide when we talked about attention, and you have the two sort of double whammy of poor attention and focus and slow processing speed, that can be really difficult, especially if we're talking about work or school types of tasks. Difficulty keeping up with fast-paced conversation is another area of impact related to processing speed. And the last sort of cognitive area where we see a lot of impact is in memory. This is one of the most challenging areas to treat effectively. In order to work on memory, there are several different things that we do, which are both sort of building those foundational cognitive skills themselves, but also developing strategies to aid memory and especially aid getting things into long-term memory so that they can be retrieved later. So short and long-term memory deficits, working memory deficits, and these are two different types of memory. Long-term memory is the memory that you need to imprint on your brain and then retrieve later. Working memory is like the RAM on your computer. It's where you have input of information and you need to hold that information so you can manipulate it in real time and transform it into something else. So two different areas of impact for memory. People who struggle with memory have difficulty learning new information, often forget appointments, assignments, or conversations. And so again, it's a combination of working on the skill itself, as well as strategies to support.
Rachel,
Last
I'm
of
sorry to stop
Yes.
you again. If you don't mind just slowing down a little bit,
Okay.
if you can see in the chat, I think it's a little hard for someone to, well, actually, for all of us. Uh,
Yep.
and
Okay. I'm
don't
not.
worry,
Let me pull up the chat, Peggy, so I can see it
yeah,
here.
don't worry about the time. We can go over, and I don't want you to hurry through your presentation.
Okay.
Thank you.
All right. Hold on one second. All right. Are you guys able to see the slides again? Yes.
Yes.
Okay, perfect. All right. So the other hidden piece that often happens for patients with TBI is are difficulties with emotional and behavioral regulation. So these aren't specifically cognitive skills, but this piece can be impacted by difficulties with cognition and also may need to be supported by other professionals who have more of a maybe a talk therapy, psychotherapy approach. So, working on the emotional side as well as the thinking side. So, some other things that you might see in patients with TBI is irritability, emotional ability or changeability, anxiety, depression, lowered frustration tolerance, poor self awareness, impulsivity, or social disinhibition. So, again, some of these kinds of changes, the behavioral changes, can often make a person that you love who's recovering from a TBI seem like a different person, like their personality has changed. And so we see these as well. And when this is in the clinical range of concerning, we definitely want to make sure that we're addressing this from the psychotherapy side. All right, so let's go back to our case study. Benji, when he came to us, he had concerns around a number of these areas that I just shared. His most pressing concerns, the things he was most worried about, were his memory. That was the most difficult thing, and especially for new learning new information. So his ability to be able to sit in a classroom, attend a lecture, and remember what he had heard was very much impacted. He struggled with precise verbal communication. So, being able to give back information concisely. He had trouble sort of putting his thoughts together to make it clear what he was trying to say. He had difficulties in executive functioning skills, particularly the areas of planning, organization, task initiation, and time management. Because his goal was to get a job and get his driver's license back and return to school to start community college, all of these things were really critical skills that he needed in order to be successful. He struggled as well with processing speed, mental stamina. And this is another one too that's sort of sneaky because sometimes patients with TBI can do things at a high level cognitively. So when they're thinking, but they can only sustain that effort for a short period of time. So, if the task takes 30 minutes, but you only have 5 to 10 minutes of mental stamina, then that's going to be a real problem. And so that mental stamina is something that we have to build over time. And he struggled with learning new information. So these are Benji's presenting concerns. So the question is, what do we do? What do we do for a client like this? And here is where we lean on the research that's been done in how to change the brain. This idea of neuroplasticity, the idea that the brain can grow and develop new neural connections with the right kind of stimuli, no matter how old the client is, no matter what the presenting concern is, whether it's a neurodevelopmental condition or an acquired condition like a TBI or a learning disability or a processing difference. We know that we can develop new neural pathways for learning. And so in our practice, we lean a lot on the work of this man, Professor Reuven Feuerstein. Reuven Feuerstein was a psychologist. He was born in, I think, 1912, 13, something like that. No, maybe 1920. I got to look at my notes again. I forget the year he was born. But he was a psychologist. He grew up in Romania. He was brilliant, went on to do research with Piaget in behavioral psychology. So he's one of this sort of family of behavioral psychologists that have really impacted how we understand thinking and learning. Piaget was one, Vygotsky was one, and Reuven Feuerstein was a student, a contemporary of Vygotsky and a student of Piaget. So he was one of the early people to believe that we can change the brain. When he was studying with Piaget in the 1930s, that wasn't widely believed. The belief that psychologists held at that time and for many years after that was that cognition was pretty much fixed. You were sort of born with a certain level or capacity for thinking, and there wasn't a lot that you could really do to change that. Reuven Feuerstein didn't believe that. He believed that with the right stimuli, we could change the brain. The problem was in the 1930s, he couldn't prove it because we didn't have the fMRI scans, the ability to be able to take pictures of the brain working and see the changes that happen when we apply different stimuli that we have today. So now that is absolutely foundational science. We know that the brain is a plastic organ and that it can change and grow. But we didn't know that in the 1930s. But Reuven Feuerstein believed that we could do that. And his theory which is called structural cognitive modifiability, was put to the test in World War II. So I told you that he grew up in Romania. He was part of an Orthodox Jewish family, and he had to escape Romania when the Nazis came in. He and his family barely escaped with their life. They escaped to Israel, and they lived out the rest of World War II in Israel, and he continued to do his studies and his research there. After World War II, the Allies came, they liberated Europe, and at that time, of course, they freed many, many people from the concentration camps. Most of the people that survived the concentration camps were teenagers and young adults. Why? Because they were the strongest, they had the most to offer in terms of work, so they were more supported. And so after the war, we had this huge population of young adults that had no families, nothing to return to in their hometown. Their families had been killed, and they were completely shut down with the trauma of their experiences cognitively. So they were so impacted by, some of them spent years in concentration camps, that they could not function in society anymore. And so the Allied countries got together, said, what are we going to do with these people? They ended up putting them in um, institutions. A lot of them were in France with the goal of rehabilitating them. Many psychologists tried and failed, and educators tried and failed to rehabilitate them and said, this is sort of a lost generation. There's nothing we can do. They're so shut down by their trauma. Reuben Feuerstein did not believe that. He believed that these people could change and that they could get their cognition back. But the question was how. So he developed two different pieces of a program that we still use today. The first is called the mediated learning experience, which is all about how human interaction in a therapeutic session of asking questions will cause the brain to make connections. So it's a targeted questioning protocol. Reuben Feuerstein also identified 28 different cognitive functions in the brain that need to be developed and healthy in order for someone to be a good thinker. And he named those functions. And on the basis of these two pieces, he developed a protocol of instruments or exercises that would help build up deficient cognitive functions through this questioning protocol called mediated learning. And the foundational belief then is that we can change the brain and we can continue to develop new neural pathways for learning, no matter what the starting point is for the learner. He famously said that chromosomes don't have the last word, because he worked a lot with people with neurodevelopmental disabilities, but we could also say that diagnosis doesn't have the last word as a corollary of that. As I mentioned, he identified 28 different cognitive functions. We don't work on all 28 simultaneously, but here are just a few of them that a good foundational program that's working on cognitive skills might address. Things like developing clear perception, learning to label and categorize, developing planning behavior, defining the problem. These are all different areas that a good cognitive skills program will press into and lean into when these are deficient areas for a client in terms of their thinking skills. We find many of these to be areas of challenge for people recovering from traumatic brain injuries. The method that we use for developing these skills involves one-on-one mediation. So that essential component of the therapist and the learner in a one-on-one session allows us to personalize our questions so that we create active learning in our client. So it's all about asking questions that cause the client to think. It's the client or the patient that's going to be doing the talking and thinking. We as a therapist are just guiding them, because it's really about pushing into those areas of cognition that are difficult and helping them find a pathway through. Cognitive skills exercises are another component. So we're mediating these exercises. The three primary characteristics of these exercises are that they have to involve novelty. So there has to be something new for the brain to do in order for it to change. There has to be it has to be sufficiently challenging. So when we're talking about learning an academic um, subject, we think that we want, 100% mastery of that subject. So, you've done well on your math test if you get 100%, you get every problem correct. And that's true for a math test. But if we're talking about cognitive skills, if I give you an exercise in cognitive skills and you get it 100% correct, that means it wasn't hard enough because I'm not actually challenging your brain. So it's really in the errors that we know that we're doing the right kind of exercise to grow thinking. And so it's working through those errors, asking questions that help our learner find the pathway through to the right answer that impacts brain function. And finally, there has to be a sufficient amount of intensity. So you have to do it often enough. So in our program, it's twice a week that we meet for sessions. If we do it any less than that in the beginning, it's just not sufficient intensity to make effective progress. So we have the one-on-one mediation. We have the exercises that come to us from Reuven Feuerstein. The Feuerstein Instrumental Enrichment Program is the program that we use at Learning for All, but there are other kinds of cognitive skills programs as well. And the last two components are reflection and practice. So you may have heard it said, it's not the things we experience that we learn from, but it's the things that we reflect upon. Not the things we experience, but the things that we reflect upon. So we have a lot of experiences that don't really impact us. But when we stop and think about our experiences and crystallize those and create a takeaway from that experience, that's where the growth and development happens. So we want to leave space. Our program has space for both reflection and practice at home. And finally, probably the most important piece of any cognitive skills program, especially for adult patients, is this idea of application to life. So the most effective programs involve one-on-one therapy with a human mediator. You'll find that there are a lot of sort of computer-based programs for growing cognitive skills, and there can definitely be some benefit to those programs. But oftentimes those programs create splinter skills. So you get really good at playing the brain game, remembering 10 of the 15 items that it showed you on the screen, those kinds of things. You can get really good at that. But if we don't have a way to transfer that to something practical in life, it's not going to be very effective long term in terms of long-term therapeutic outcomes. All right, I'm not going to spend a lot of time on this slide, but you'll be able to go back and review it. But what are our primary objectives in therapy? First, we want to develop metacognitive awareness and self-monitoring. So what is metacognition? It's our ability to be able to think about our thinking or to stand outside of our own process and analyze it. So it's one thing for us to be able to solve a problem. It's a different thing for us to be able to articulate how we solved it. What was our strategy? What information did we need? What information were we missing? Did we try something that didn't work? If the thing that we tried that didn't work, how do we adjust? Were we able to come up with a different strategy and try that? This is all a metacognition, analyzing our own process and self-monitoring. We also want to work on strengthening attention and cognitive control. So that ability to sustain attention is related a lot of times, again, directly to that mental fatigue, that we need to build the capacity for our brain to sustain a high level of effort. And the more complex the task, the more mental effort is required. And so the more stamina we're going to need. We want to enhance executive functioning in daily life. So again, these are those very practical skills: planning, organizing, prioritizing, time management, task initiation. So for executive functions, we have to develop some of these foundational cognitive functioning skills. An executive function development involves applying systems to those skills. So if the goal is to be better at planning, we are going to need a system to do that, a calendar system, a reminder system, a list system, some kind of system we can effectively apply with consistency and accountability. We want to increase confidence and independence. And here is where a lot of the social emotional pieces come in. If we're experiencing depression or we feel like we're failing or we're frustrated because our processing speed is slow and we can't follow conversations, all of these things impact our social and emotional health. And so this is another important area to address. And finally, rebuilding those functional memory skills. So, again, like executive functioning, issues with memory involve not only strengthening underlying cognitive functions, but creating systems to help us remember important information. So the 5 core cognitive areas that we want to address are attention and concentration, language and communication, executive functioning, processing speed, and memory. So let me share a little bit more about Benji, about his outcomes. We ended up seeing Benji 4 months worth of sessions. We saw him twice per week for about 4 months. He noted for himself significant improvement in focus and attention, mental stamina, organization and planning, memory for new information, and his overall outlook on life. He was much happier and more confident when he was done with his time at Learning for All. At the end of that summer that we worked with him, he was able to get a part-time job and he returned to community college. I think I just told you he was about 20 when he worked with us. His mom was hoping that he would continue because she had seen improvement. He decided, that he wanted to take a break from therapy sessions, and he didn't end up coming back. And part of that probably was because he had achieved some of his goals that he was looking for. But it certainly is challenging work, and I think that's also a piece of it. But overall, very good outcomes for him in terms of his goals and what he hoped to achieve with therapy. And that's really most of what I have. I wanted to try to keep it to 30 minutes and honor your time. At Learning for All, we offer a multidisciplinary personalized educational therapy and the comprehensive cognitive skills program. You can learn more about this program on our website. We also have free resources, upcoming webinars. We do a lot of community education, outreach to groups like Beyond Concussion to share a little bit more about building cognitive skills. And so some more information here if you are interested in that. And with that, I will stop sharing my screen and we will open it up for questions and answers. Thank you, 1921. I know it was close. I appreciate that. All right, any questions?
Of course, thank you so much. Um, yeah, I would really love to have a little piece of any of the therapies that you normally do. I kind of want to hear how it works. So
Yes.
I
Okay.
don't know if we can do like a role play or if you can just, kind of give us an idea of, is it all just talk or, do you give
Yeah, that's
paperwork,
great. So
homework?
let me pull something up. Those are great questions, Peggy. Somebody's asking for the website, so I'm gonna pull back that while I talk about it. There we go. All right, pop that back up in the chat for you. And so we have our sessions have several components. The first component is going to be a sort of, we always start a session with with reviewing journaling. So, journaling is one component of what we do. So, we're sending journal prompts home. We're asking clients to do homework at home where they're writing in a journal. We have sort of prompts that help guide the thinking around that, but a lot of it is sort of stream of consciousness journaling. So, if you're familiar with the artist's way, this idea of just journaling your thoughts, spending 10 minutes a day writing down just what you're thinking, no pressure to come up with anything. And that is really helpful for processing. So we always start a session by reviewing that. We always start our session by reviewing our thinking focus. So when I showed you those different cognitive functions, we're going to have a different cognitive function every session that we're focused on. So that sort of helps frame what we're going to be doing in that session in terms of what cognitive skill we're working on. We also have an at-home app-based program that's cognitive skills. And so remember, I had said there are a number of different programs that you can use with a computer or a tablet that will build individual sort of cognitive skills, things like working memory, visual memory, auditory attention, problem solving, those types of skills. You can play games to do that. So we have an app that helps develop some of those pieces following multi-step instructions, especially given verbally. Those are some of the skills that you work on. So we bring that back into the session, and now we want to make application to that for life. So that's sort of the first 10 minutes of the session. The next chunk of the session is going to be working through the Feuerstein instruments, which are either you can do them on the computer in real time or pencil to paper, but they're different types of cognitive tasks. So let me hopefully everybody got the website down. I'm going to pull this down for a minute and show you an example, Peggy, of a page from Feuerstein Instrumental Enrichment. So you can see a little bit what that looks like. So let me get that up on my screen here. All right, so let me share this with you. All right, so this is an example from a page of Feuerstein instrument enrichment, an instrument called Organization of Dots. And so this works on a number of different cognitive skills. The pages, this would be several iterations into it. So you would have had other things that sort of led you up to this point in terms of being able to solve this page. But this page is about looking at the model, which is at the top, identifying what you see here, and what do you notice about that model? You guys can unmute. What do you see in the model?
Fish.
Yeah, how many fish?
Looks like there are two. I don't know.
Good.
Bottom one could be a boat.
Oh, nice. Good. And we can call it whatever we want, whatever comes to mind. We want to make sure that we give it a label that we can both refer to and know what we're talking about. What the task is on this page. Anyone can answer. You can unmute. What's the task?
Connect the dots to
Okay,
make a
good. For what?
shape or a
Yeah.
form of some sort. But then there are eyes in there too.
Okay, nice. So, so the eyes, how might you use the eyes to complete this task?
So connect the eyes or connect the dot. I don't know.
Yeah. You're doing a good job of thinking, Peggy.
Come on, somebody, help me out here.
I know, Peggy. This is group mediation.
Yeah, you could just I mean, you could make sure the eyes are in the spot of the eye and make sure you're going around it, like the fish that are already drawn.
Ah, okay. So the fish that are already drawn are going to help us, right? How are they going to help us?
Well, I mean, you could try to replicate them, I guess is what I'm saying.
Good. Yeah. So that's a really great theory. Theory is that the task is to replicate the drawing. Okay. And you would be right. The drawing is the model. And so the task is to replicate the model. I'm mediating you right now, by the way. This is an example of mediation. I'm not telling you what to do on this page. I'm asking you questions that help you see if you can figure out, using what you know and what you observe, can you figure out what the task is? Okay, that's what mediation is. It's not me giving you instructions. It's me asking questions that help you use what you know to figure out what you don't know. And as Peggy noted, it can be uncomfortable to sort of be in the hot seat of mediation. If I asked her a question and she's like, I'm not sure how to answer that, right? I don't know what to say. Somebody help me. That it's that place. Feuerstein calls that disequilibrium. It's that feeling of uncertainty is where your brain starts working. You have to pull other information. You have to come up with other ideas. All right. We don't have time to work this whole page today, but if we did, we would notice, as pointed out, the task is to recreate these images using the dots. Okay. If you look at this whole page of frames, what do you think is, do you think that all of our frames are going to look exactly like the model?
No.
Why not?
Well, the dots are all over the place.
Hmm.
Yeah, are they the same place in every frame?
Mm-mm.
They're
No.
not.
What else is changing position besides the dots?
The circles,
Eyes.
the
Yeah.
eyes.
Yeah.
The eyes are in different places, right? So that's a clue right there that we're actually, that these shapes that we're trying to find are going to be in different positions, different orientations. And so that's going to require us to develop some strategies to find uh, to find um, their place in these different frames. And so that's one example of the task, Peggy. There are lots of different tasks in Feuerstein instrumental enrichment. Some of them are, that's more of a visual spatial task. We have tasks that are more verbal comparisons, and different types of modalities. But the goal of every task there, because it's being mediated, because I'm asking you questions about what you need to do, is to pull language about your thinking. So my primary goal as a therapist is to get you to talk to me about what's going on in your brain. What is your thinking process? When went back to that idea of metacognition, thinking about our thinking, that's what I'm trying to help you understand. And I'm trying to understand about you, what's going on in your brain, so that I can help see where some of those connections are that need to be strengthened. I'm not going to I'm not going to give you the answer. I'm going to ask you the questions that cause you to solve it, because when you solve it with your own process, that's when those new neural connections happen. Does that answer your question, Peggy?
Yes, absolutely. That's exactly what I wanted to see, just to get a little feel of a piece of what you do.
Yeah. I'm
Would
really
you
glad you asked
also
that.
would you also mind sharing your app with us? Because I think that would be amazing. I would definitely take advantage of that.
Yeah, so the app that we use is something that we use in clinic that's specific to our program, but it's similar to a lot of just sort of commercially available apps that you don't have to be a therapist to use. So if you are looking at something like Lumosity, if you've ever seen that, or any of those sort of like brain training cognitive skills programs, it's going to be similar exercises to that. It's just that it's going to be much more guided because it's going to have a clinician assigning you tasks kind of based on your profile, and adapting it to your program and then connecting it with, the dots or whatever the exercise is in the clinic. So you
Okay.
can do a lot of that with commercially available program. I mean, none of that, all of that stuff is great, right? We're playing brain games. They get us thinking. But here's what I would say for anyone who's doing a commercially available brain training app. It's not about just about getting good at the task in the app. You have to be able to connect that with something in real life that is meaningful. And that's where, when you have been mediated and you start to become your own mediator, because our goal is not for you to be in therapy sessions forever and having the therapist ask you the questions. Eventually, what we want to have happen is that you become your own mediator. You start asking yourself those same questions. That's the flexible skill, because the challenge or the task is going to change, and that therapist isn't always going to be there to help you guide your thinking by asking you questions. But when you become good at asking yourself questions that help you identify your strategy, take a different approach, consider another point of view, define the problem, recognize that you need to use systematic search or hypothetical thinking, these different cognitive skills, then you can take that skill and you can apply it other places. And that's the goal. That's the transfer part. And that's what so many programs, that's the hardest thing to do, right? It's great for you to do it in a therapy session. But can you now take that out into your life and use it in a flexible way? That's always the goal.
Okay. For some reason, I thought I was under the impression that Learning for All had an app.
No,
That's
we
why I
use,
thought, okay.
yeah,
I
yeah,
understand now. All right. It's always hard to know which ones are good. I play games every night trying to, help with my cognitive issues and memory. And one thing that you did mention in the very beginning, finding words. Um, that's probably one of my most difficult things for me every day. I know the word, it's in the back of my mind, but it just doesn't come out. Um,
yeah.
so if there is an exercise that you would recommend for anyone that might have that issue as well, be great.
Yeah. A lot of what happens with word retrieval, and I also work with seniors, which is something that we also see with seniors, is a piece that it happens sort of early on in the decline of memory over time. Um, and a lot of times it's there, but you need more think time, not under pressure, because we end up when we're trying to I don't know, you've probably had this experience. I mean, everybody has this experience too. It's not just specific to people who have cognitive challenge or people who are seniors. We all have moments at this, but it's when you're trying to pull that specific piece of language and you can't get it and you can't get it. And the harder you try, the more elusive it is. And then as soon as you switch context to do something else, right, it like pops into your head, half an hour later when you're not thinking about it anymore. And the evidence there is that, it's that cortisol, um, of the pressure that we're putting on ourselves to pull it in the moment. And sometimes we just have to be able to take a step back and lower that. But we put so much pressure on ourselves that we sort of like shut down our prefrontal cortex, and we don't have those skills that we need in the moment to pull it. And so some of that is slowing down for sure and giving yourself space and knowing that it's okay. But the other way too to find some of that information is using different kind of sensory input. And this is the same thing that we use for for memory, like short-term memory, what they call it short-term memory, which is like remembering the grocery list or something. People call it short-term memory, but it's really a form of long-term memory. It's actually something that has to be imprinted and be able to pull back again. And so one technique for that, Peggy, is using different kinds of sensory input to imprint the information. And so if we're only looking at a list, maybe we need to repeat that list, or, add a verbal component, or add a tactile component, or a spatial component. If I know that I need to go to the grocery store and I have to get butter, milk, oranges, and bread, okay, I have 4 things I have to remember. They're on my list. I get to the grocery store. I can only remember 3 of them. I haven't imprinted it well enough, and I need to find a better strategy if I'm trying to remember it without my list. And so, we can organize the information. So maybe I'm going to alphabetize it. Maybe I'm going to remember there are 4 things. And now maybe I can just remember the first 4 letters of bread, eggs, milk, and oranges. And that will trigger it. Maybe I make a mind map before I go to the store of walking through the store and picturing myself, my pathway through the store as I pick up each item. First, I'm going to walk in, I'm going to turn to the left because that's where the dairy case is, and I'm going to grab the milk. It's in the blue carton, right? And so there are different ways that we can imprint information, different sensory strategies that we can use that can help create a more structured foundation for remembering information that we need to remember. And we also have to recognize that not everything that we experience is important for us to remember. And so we need to not put pressure on ourselves to try to, that we have to remember absolutely everything, right? It's a finite amount. So what's important, how do I remember what's important? And can I have strategies? I mean, if I can write it down on a list, I can do that as an exercise to build my memory, like playing brain games, that's really good for the brain, but there's also other ways, other strategies we can use too.
Sounds good. Does anyone have any other questions? Well, doesn't look like it. Oh, maybe. Aaron, hi.
Hi, I just wanted to touch base again. I really enjoyed the talk. Thank you. Um, I really like the idea of being your own mediator. So your example for that was was great, and I really appreciate that. As a physical therapist, I think one of the most important things is like teaching individuals to be advocates for themselves and then be able to problem solve in situations, where they're not going to be able to access you for information. And I like this idea of similarly from a cognitive standpoint, being able to, or different strategies to think through things to reach an outcome, that is what you want to achieve. So thank you for that. I really appreciate it. So though my screen was off, I enjoyed listening. And Peggy, you did a great job with the fish and the dot example, that
I
exercise.
know, getting put on the spot. She did
I
great.
thought that was
There's a
I thought it was really interesting. So yeah, the empirical examples are, I think, yeah, those were, I appreciated those. So thank you.
Awesome.
Thank
Great. We
you.
have a couple more questions that just popped in, Peggy. Do we have a couple minutes that I can answer these?
Absolutely. Yes, yes.
Okay. Awesome. Asks, what type of strategies do you have for organization and time management? So organization and time management are both under executive function. And those are again, we said that executive functioning piece is sort of the brain's manager, where we pull everything together that we do cognitively to be able to complete a complex task, especially a task with multiple steps. So what kind of strategies do we have? Before we get to systems for organization or systems for time management, we have to address underlying cognitive skills. And so this is where, going back to those dots page, it doesn't seem like working, trying to find 2 fish in a boat by connecting dots is necessarily working on something like organization. But when we try to complete this page, we're going to find that we actually have to have a lot of strategies for organization. What is organization? Organization is taking multiple pieces of information and multiple criteria that we have to apply to that information, right? And transforming it according to this criteria. So organization might be placing things into categories. It might be creating a step-by-step process where one step builds on another, so it matters what order we're doing it in. It might mean creating some kind of system for retrieving information, complex information. So organization can involve a lot of different sort of practical processes. So one of the things that's very effective is to take an exercise like working through a page of organization of dots and talk about the organizational principles that are required to find those fish on these. I'm going to share it with you one more time on this complex page right here where every frame is different. Okay, the orientation of all these fish eyes is changing. Here's another one. All right, we're working with three-dimensional objects. We have some clues and some hints and things that help us, but notice for this task, we have actually three different shaded pieces in the model, and none of our frames have three. So as the pages progress, there's more and more complexity, more and more what we call virtual projection that we have to do. Our brain has to see these shapes, even though all that's here is dots, right? And how do we do that? We're going to have a strategy to find these shapes in these fields of dots, just like we did up here with the fish and the boat. So these are underlying principles that affect the cognitive processes of organization. When we're not talking about executive function, we're usually talking about organizing my my utensils drawer, right? That's what we think of when we think of organization. I have all this stuff and I want to make it neat. And so that's a practical piece of organization, but we bring in those principles. What's a good way to organize it? All the spoons go in one slot, all the forks go in another slot, all the knives go in another slot, different sizes, what will fit in the drawer? How will it fit? What about if we have stuff in the drawer that doesn't fit in any of these categories? What are we going to do with it? So those are all pieces of organization then that become practical that we want to create a system for. And time management is similar to that. Can you provide any tips for dealing with the increased anxiety and feeling nervous all the time? Yeah, and that is really difficult. Anxiety when we see anxiety in our clients, there's usually multiple antecedents. But I would categorize those antecedents primarily in two categories. One is an emotional antecedent. So there's an emotional piece that's causing anxiety, an experience, something, that maybe it's your injury or something that happened to you, or other pieces of sort of your emotional past that are impacting that. That's one component of it. Actually, there's three now that I think of it. The emotional is one. There can also be a brain chemical component, which is why there are some good pharmaceutical things that can help because it's actually changing the norepinephrine and the dopamine and the other sort of brain chemicals that impact anxiety. And the third is the cognitive piece, because if we struggle with thinking, and we know we struggle with thinking and we're not able to get our brain to do what we think it should do or what we want it to do in a moment, that's very, very anxiety producing. And so if we're able to start creating some skills around cognition, that's one area of anxiety that we see reduced. And if we go back to my example of Benji, the client that we worked with, I think that a lot of the reason that his outlook on life was so much better when he left therapy was because he had developed the confidence to believe in himself that he could, keep his job and he could complete his community college course. And so that was able to offload a lot of the pieces of him, that unknown of feeling like, I'm not sure I'm going to be able to do this. All right.
So,
Well, I think that's all the questions in the chat, Peggy.
yeah, oh, one more.
Oh,
One more just popped
sensory
up.
overwhelm. Yeah, very good. And so again, if you're in the chronic stage, in the beginning, if you're still in the acute stage, that's something that's gonna be there and until it sort of stabilizes. Once it stabilizes, if you're still having a lot of sensory overwhelm, and this is where somebody like Erin can really help us, an occupational therapist. If we're seeing a lot of things that are happening in our body, that can be a really great supportive co-therapy to working on cognitive skills, because an occupational therapist is going to address that sensory overwhelm from the standpoint of the body. So I feel, like I'm coming out of my skin, or like there's too much stimulation or there's not enough stimulation. You're saying overwhelm, which is too much stimulation. Some people have not enough. But what do I do when there's too much stimulation? How do I manage that in my body? And that's a place where an occupational therapist referral can be super helpful, because that can go really well with also working on the cognitive side. All right. Well, thank you, everyone. It was such a pleasure to be with you, Peggy. And thanks again for your patience with the schedule change.
Of course. Thank you so much. Thank you for your time and all the information that you provided for us. And we will definitely put this up on social media, send it out in our newsletter, and have the recording edited and then uploaded onto YouTube so you can share it with anyone else that you like. But
Wonderful.
yeah,
Great.
thank you.
Well, thank you, everyone. Best of luck to all of you. And thanks again for having me.
Thank you.
Thank you, Rachel.
All right, have a good night.
You too.
Yeah.